You're listening to the Patient Advocacy Now podcast, presented by Greater National Advocates.
It's just gut-wrenching sometimes. Like, if it's sad and they're crying, I might cry.
Amazing how many doctors do not even want to treat somebody who has Medicaid.
Medical system is about making money.
And I said, so are you hiring more nurses, or you're just telling each nurse to work harder?
Nancy Ruffner, thank you for being on the Patient Advocacy Now podcast. Welcome. How you doing today?
I'm doing fine. Thank you so much for having me.
Yeah, absolute pleasure. You know, it's always, to me, where I feel like a good place to start is understanding, how you came into this, why you're an advocate, why you kind of do what you do. Because there are a lot of similar stories, but there's a lot of nuance and difference in the background. Some people start as patients, some people start as nurses, and some people kind of, are gung-ho for one reason or another. So kind of take us through how you got into this field, why you're still involved, and what kind of motivates you.
Happy to. I am so pleased to be a part of this industry as it unfolds. It has, for me, become my beam. I looked for a long time for the exact vocational fit and the heart fit, and I found it here in patient advocacy. I completed my undergrad degree when, dinosaurs roamed the earth. In the late 70s, I emerged from the School of Social Work because, if you were a female in the late 70s in the liberal arts, they're going to send you on down to the School of Education, the School of Nursing, the School of Social Work. So there you have it. I emerged as a social worker with my cape on and proceeded to work feverishly to change the world. And quickly, a young professional with no professional boundaries, I burned out. I knew, I'd learned a lot. I knew a lot. I enjoyed working with people. I loved honing my communication skills. But for a time there, I stepped out away from social work and went into manufacturing for a couple of reasons. It was still in its heyday in the 1980s, and my last name meant something in the state where I was living. And so it was easy for me to land some good positions there in production supervision and management. And in doing that, sometimes you learn by backing into something. I learned what I was missing. I was missing providing a service. And so I thought, all right, I've got great communication skills. Let's try sales. And so there ensued a time of inside and outside sales. And with that, I loved the business buzz. It was great. I was helping people. I was kind of sort of in my mind providing a service, but it wasn't feeding my heart, and it wasn't moving the needle the needle that I thought needed moving besides my wallet. When you enter the School of Social Work, you leave your wallet. You check your wallet at the door.
Yeah, there's a lot of truth to that. Yeah, for sure. Yeah. What kind of product was it, just out of curiosity?
Oh, I sold a lot of different things, mostly services, because that's how I was justifying it, selling a service. I even sold weight loss services. A lot of different things, management services, consulting services.
Okay,
blah, blah, blah.
Okay, gotcha.
And because that's how I was justifying it. I'm not selling a thing.
Yeah.
I'm selling a service.
I'm helping people in a way. Yeah, right. Yeah.
Yeah, that was the message to me. I think that I came a little closer. I was introduced to the world of EAP, Employee Assistance Programs, and I gladly climbed into my seat in cubicle land because I could, under the service delivery model of an EAP, I was doing very much like what I was doing now. Intake, assessment, research, referral, except there was a bye-bye at the end of that, and I had no closure. I was performing a great service to people who really were calling in for help. And I believe that I did help some people and guide and point them on their way. I was missing doing the do, if you will, really getting out there and providing the service. About that time is when my own parents were aging and changing, and I was needed more to help with their planning and caregiving and participating in that. And I'm very grateful that my employer was flexible, and that's not easy to do in a 24/7 operation. So I always try to laud them when I can. They were flexible, and they helped me to be able to help my parents and perform my job function. Apparently, I might have been a little loquacious about what was happening to us. As we entered into the world of elder care, we saw missed handoffs, mistakes, gross medical errors, lack of communication between all the providers. And, that was my parents that they were talking about. Right. And so I think people started saying to me, you should hang out your shingle. You really should hang out your shingle. And I found that I was pretty good at this. I and my sister thought we were the two best daughters on the planet. She worked for the ombudsman. I had full research and access to professionals within the EAP job I was holding. But yet we still met with debacle. So people were saying, hang out your shingle, hang out your shingle. And I said, I could never. Why would I ever want to leave this nice job with the matching 401k and the fitness center down the hall? And the call got louder inside of me, and also unsolicited requests from various parts of my life. And so that I could never became maybe I could, and and then I will. And then I did. And I have never looked back. So tendered notice, hung out that shingle, became a patient advocate, and went at it myself. As I grew, I asked other people to come into my team and assist me. And for a while, we were a small but mighty agency. And I feel like that we moved the needle in the Raleigh-Durham, North Carolina area, and in the Southeast in general.
That's great. What does the practice look like now?
We ran for 10 fun and long years. I got a little big, and then I reduced the size a little bit to find our operational sweet spot. I think over the years I incubated several people that have gone on now to hang out their shingles, and for that I'm proud.
Yes, you should be, for sure.
Yeah. Oh, it was great fun, and we served a lot of people. I like to call them the 500 families, because those are the 500 families that I'm bringing. Those stories, that experience, and everything that could go wrong, kind of warnings, I bring all that with me when I work with my clients today. So that was helpful. At the end of the year last year, I closed Navigate NC, which was the agency in North Carolina, and I moved further into solo practitioner. Thank you, pandemic, if that even sounds crazy to say it. But what the pandemic did for so many of us in healthcare, and certainly in patient advocacy, was to drive us further online.
Yeah.
As soon as it hit, I'm not afraid to tell you that my business in March of 2020 went down by about 90%. Wow. Boom. We're no longer going to the ER. We're not going to the doctor's appointments. We're not going to meet at the attorney's office. I can't go see mama at the skilled nursing facility. All of that came to the screeching halt. And so my reaction to that was to help other people get their sea legs. So we immediately went online with this new thing called Zoom, new to us. And I did an 8-week webinar series and a 16-week trying to help people deal with the emotions and also find the services that they so sorely needed. Working in elder care at that time, there was a lot of confusion. Teaching people how to use Zoom, teaching people how to go through a telehealth appointment. Yeah. Learning the technology or being there and helping enable it. And so I saw that as a new form of advocacy for me. I saw inside the patient advocacy industry, a lot of people were struggling to make the adjustment. I think that month we had a new cohort of BCPA, board certified patient advocates, had obtained their certification. And there were people that were struggling and a few that were circling the drain. And I thought, I can help you because I've learned this social media stuff. I know how to do operations. I'm getting accustomed to the working online and meeting online and teaching. And so that all rolled into let's speak online, let's teach online, let's coach patient advocates, let's keep working with the patients too, but let's bring everybody along so that furthers our industry, it helps our clients. It's great if I can go out and help, some families to my capacity. But wouldn't it be better if I had a little hand in getting more people out there to help? Because the gaping need is there. The consumers need us, and we have tremendous expertise. And I'm very serious about helping to prepare more people to fan out there and provide solution.
How have things, other than Zoom and kind of going more online, what other changes have you noticed over the decade that you've been doing it?
I began to be asked to speak more. I was lucky enough to become an adjunct instructor, first on the community college level, where I could design my own class. And wouldn't you know, it was one to bring more people into the elder care industry. So I got to write it and I got to deliver it. So that was fun. And then I began teaching in two lifelong learning curriculums, the OLLI program for NC State and for Duke University. And so I wrote those courses as well, a consumer's guide to healthcare advocacy, where we travel through the planning for hospitalization, the actual hospitalization, the discharge home, and whatever came next. And so that was a lot of fun. And from that came more opportunities in presentation and everything from faith-related groups to national conferences.
So a lot of extensive changes and big movements and stuff. It's really kind of exciting to see you speak and do more of that kind of outreach on platforms. I know one of the things you speak about is that we haven't really talked about on the podcast before is solo aging.
Right.
First of all, let's define what solo aging is for people who are unfamiliar with the term.
Absolutely.
So go ahead.
They are persons who, by choice or circumstance, are aging without the support of built-in family caregivers. We generally will talk 55 and older, 65 and older. It is a growing subset of our aging demographic. So, the numbers are bigger than we all thought. So
it's people without a living spouse or children who are local or children at all who can kind of help take care of them. Am I kind of understanding it right?
You are. Initially, it was folks that never married, didn't have children, that kind of thing. But the expanded definition, and you hit on it 100%. We're far flung from our families today, and or our family member may not be the best person for the job. And so, the expanded definition of solo aging is yours was apt.
I'm glad to hear that. And so, obviously, it's a lot more challenging as you get up in the age kind of department, and you don't have that support. What's, and you are very open about being a solo ager yourself, correct?
Yes. Mm-hmm.
So,
yep. I like to joke around and say, yeah, I are one.
I like that. What's, what are the typical challenges that you see as a solo practitioner when you have a solo ager come in and need some help navigating the healthcare system? How does that change the way you approach it, or how you give them advice? What's different, and how do you overcome some of those challenges?
I think it begins with anticipating and knowing what their needs may be. It is again, another time that we can be fully customizable in our approach and in our services. Everybody's different. This patient advocacy is not a cookie cutter business. Every single case and person is unique. And this working with Solo Agers is no different. The things that they need, the things that I need, are everything from careful planning, relative, and planning it all the way out. Let's play the tape all the way through, y'all. I think that it covers what I call the 5 pieces of the pie. I call it a pie because we're going to talk about medical and legal and financial and insurance and housing and support. Support is key. The thing. Let's repeat those, because I think it's really interesting that you broke it into 5 categories. So say them one more time. There's support. Yeah, it's medical, legal, financial, insurance, housing, and support. So it's a 6-piece pie to me, and I use that little overlay in all of my work with folks. We're going to talk about them all. You're going to have bigger pieces. Some pieces of the pie will be bigger than others.
Yeah.
and scarier. I think with Solo Agers, obviously the medical, what's going on with me, who will come see about me, isolation and loneliness is huge consideration. Building community is key. And here we are all at a time later in life, probably having retired, and our world is getting smaller at the exact wrong time. We need to build and not dwindle. So the community is and support are absolutely key, but also making good legal plans. Yeah. How's this going to roll? Getting your documents done with careful legal planning, and the big sore spot, and here it comes again, is not only naming beneficiaries but naming your agents with power of attorney or your proxies. Who's going to handle the financial part when, say, my cognitive skills go? Yeah. Who is going to be my help me have a say about how things are going to go and where I'm going to end up? Who's going to be my healthcare proxy? Who's going to make sure my wishes are enabled? Mm-hmm. And I don't have anybody to designate. I don't know anybody my own age. How do I meet new people? Because my world is getting smaller. And there are a lot of quandaries. Now, with that, I will quickly say there's also a lot of solutions. Now, some of us are old dogs and we need to learn new tricks.
Yeah.
And we need to revisit this, how to make friends, where to find people, because it's probably a really good idea that you don't name your contemporary or a peer as your proxy or agents with power of attorney. You need someone younger.
Right.
How do we meet somebody younger? And we go on to discuss that. That's
a great point, that people who don't have the need for that question because they might have children just don't even think about. So it's nice to get that perspective. I bet you also help with some of the kind of the difficult decisions, like if you're let's play a kind of a little bit of a role playing game. Let's say I'm a 65-year-old man. I am a solo ager, and I come to you and I say, I don't know if I should stay in my condo or I should move to a retirement facility. Is that something you would help them kind of sort out?
Oh, that's a big one. Yes. And it's a favorite of mine too, because people need to shift into the mindset that, your home is your tool, and your tool's supposed to serve you. You're not supposed to serve your tool. And so we find people that stay in the place too long that doesn't suit them. And gosh, the hot water heater's going out. I need a new roof. And there's that lawn care. And so we talk about lifestyle. We talk about your must-haves, your would-be-nices. We talk about that relative to, well, what can your budget, caregiving pocketbook afford, but also, what's your lifestyle? What do you want? What must we find that match your medical trajectory as we know it? Of course, everything can turn on a dime. So if we're smart, we'll have contingencies to all of this. But it would be about what you want. What do you want, and how can we enable that? And then talking all the way through it, so that, because our job as a patient advocate is to make sure that you have the most information so that you can make the best decision for you. It doesn't have to be our decision. It has to be your decision.
Well, let's do a little bit of it and kind of hear, because I haven't had a conversation like that. So pretending I'm the 65-year-old and you're saying, what do you want? My answer would be, can you be more specific?
Mm-hmm. Okay. Well, tell me a little bit about your lifestyle. How do you like to live? What do you like to do? What do you need your house or home for?
Well, so I don't like that I have a 2-story townhouse. The stairs are hard, so I don't go up much. I watch a lot of TV, but I kind of don't like that. I'd like to kind of be a little more active. And I don't really particularly enjoy driving just to drive, but I do like to get out of the house to kind of do grocery shopping and stuff. It kind of makes me feel a little bit more comfortable as opposed to just everything being brought to me. But I'm kind of a homebody. I like to sit at home more than anything else and read and whatnot. That's kind of my lifestyle.
Mm-hmm. Okay. I'm hearing somebody who is not, structurally, the 2-story not going to work.
Yeah.
And if there's any mobility issues in your future, it's not going to work sooner than later. So we need to take a look at single-story stuff that will serve you and serve you well. And then we go all into the structural part of that discussion. We talk about budget. We talk about location. We talk about neighbors or proximity to others as a segue into community. Mm-hmm. Now, you just told me that you might be interested in doing some other things because you think TV's too frequent an activity for you. But on the other hand, you consider yourself a homebody. So what we would have to start discussing is ways that you can meet people or join in on some activities, but still have your private time.
Yeah, it's that balance.
As far as driving's always a fun conversation with older folks. And so it's good to go ahead, whether or not you have anything going on medically or cognitively, it's a good time to go ahead and say, how will you know when it's no longer time? Rather than have somebody come in with a smackdown and say, you can't drive anymore. I'm your doctor and you cannot. Let's talk about how we're going to get you everything you need and with a different plan, like ordering your groceries in, etc.
Yeah.
How are you going to get to your faith community? How are you going to find yourself among friends? How are we going to make new friends? And that's usually lots of conversations. These are multiple conversations.
Yeah,
kind of
no, that gave me a good taste of how it goes. I like that. For me, at least, it was helpful to kind of hear the way that your mind thinks in terms of approaching these things in context. I also saw somewhere, I think it might have been on your website, that you give a talk called America's Aging Now What? Or, what happens now? Can you tell me a little bit about, what you go over and some of the kind of a snippet of that talk?
Well, it's that's one where we're looking at it on a more 10,000 foot.
Yeah, that's
level.
why I ask. I think we got a good picture of okay, we get the individual picture, but I am kind of interested on a countrywide level. What does this mean?
I would say a lot of it. My mind just went to ageism. Sorry, it did. Sorry, not sorry, because with not only the people that I work with or those who may be on a medical trajectory of some sort or solo agers, America doesn't see us. You don't see our challenges. Using solo agers as an example, the doctors don't consider that I'm going to have trouble even maybe remembering what you just said to me. by the time I get home, or how I get home, or how do I go get prescriptions filled? And what if I have a question? And how do I get back here for my follow-up exam because you just was discharged from the hospital? Doctors don't see that. A lot of times it's not on their radar. And so we need to talk louder and bang the drum about what kind of things we need. On a national level, housing is huge. There are a lot of new and exciting things happening in the housing industry. And I like to think that the swell of baby boomers, there's so many of us, that we're driving change. But we're a far cry, thank goodness, from the retire, play golf, live in a nursing home. I mean, it used to be that way, but we live longer now, and we demand more of our lifestyles because we feel better nowadays. And retirement is a long time for many of us, and so we talk about how we can make that happen. How can we make legislators and innovators and people in retail, people in tech, what can we do? The tech industry is going crazy for people who are aging. There's just so much really good innovation, which will help us with to combat the caregiver shortage. And that's another thing that needs to be looked at, but the technology will help there. But planning for your community. We went way out with suburbs, and now we need walkable communities. What road? I mean, so we need to rethink this thing and shine a light on a lot of things, even retail. There are some of the big box stores that just drive me nuts because if you're an older person walking through a big box store, there's nowhere to sit down if you're fatigued. And when you are fatigued and you find a place to sit down or lean, where's the restroom? Back up at the front. I mean, we don't plan for everybody. We just like we don't plan for children with disabilities. And finally somebody came up and said, we'll have an all-persons playground. Well, we need to do that kind of thinking on the other end of the continuum too.
Great points. I mean, heck, I'm not quite a senior by a stretch, and I get tired walking around looking for clothes myself, and I often had that thought, where are the chairs? There's no chairs. Especially when I'm with my wife or kids, like shopping. I'm like, it's the one place I will say, the one place I do find that there are typically chairs are usually in the women's garments department, because there's always the, what I call the husband chair. Like, just go wait in the chair, honey.
Yep. And, we're going to see them all differently now that we've talked about it, and the folks that watch this are going to look at their retail environments a little differently, and we're going to expect and demand more.
Yeah.
Expect and demand more, and expect it for us, expect it for the people that are designing environments for us, and products for us. There are wonderful things coming out in terms of services, niche businesses. It's incredible, all designed to give us what we need, because we're going to be here, y'all. And let us not forget where the consumer power is in the older segment in the United States, especially with women.
Yeah.
We hold the purse, the purses, the coinage. Yeah. And so I think we need to step into that and drive it.
Zooming out a little bit, looking at the the patient advocacy industry, for you and the industry as a whole, where do you see it going? Where would you like to see it go?
Well, there are those among us, and some, even one of our organizations, that would say that they'd like to have a patient advocate for every patient. And that may not be a professional patient advocate. There's an awful lot of education as well to educate the caregivers, how to become an advocate, how to provide support, how to go into a medical appointment. And that's fine. It doesn't have to be me. Don't wait for the professional, because there's not enough of us. But we can, again, work to fan out more people that can be on the care partner team. So I think that's very important, and there's a lot of good work being done, and able not only in thought leaders and books, amazing books available even in your library. So that, yeah. And so I would say that while part of me resents when the word patient advocate gets bandied about, everybody is an advocate. And while that kind of makes me mad sometimes, I think it's good because everybody does need to be an advocate. You know, the friend that goes with you, the friend that drives you, the family member that assists, all are advocates. I'd say never go into a medical appointment without somebody with you. Even if they're just a scribe, we need that because we're going to forget a lot of what they say.
Yeah.
I think the industry is growing. I think the people that are going to want to join us. There's a lot of recruitment at hand from people who want to do something different. Maybe they are working on the inside and now they'd like to use that expertise on the outside to help people navigate through. And that's what I'm all about is let's use what we know and help the people find the need and help out.
If you could change something internally within the industry, within the other advocate community, is there anything where you could be a little bit, gently critical, or do you think it's really just about more exposure and education?
I'd like to see more ways to sustain us financially. There are a lot of folks who cannot afford a private patient advocate. And so I'd like to see more philanthropy, foundations established that will utilize our services, other ways to pay for care. Some people are paying it forward. Some people are paying it backward. Maybe insurance may want to participate, although I'm not a fan there myself because I want to work for the patient. Yeah. Don't squelch my voice based on who pays my paycheck.
Yeah.
I'd like to see other ways to pay those employee assistance programs. The employer could participate because don't they have a vested interest in keeping the adult child of an aging parent on the job and focused and not making mistakes and using their lunch break to make 30 phone calls to provide for care?
Or to be on hold for 4 hours, right?
Yeah. And so I'd like to see more ways to fund us. Now, we've chosen to be private practitioners, and so I need to keep the doors open for the many. Do I do a lot more work or pro bono work, things off the books? Yes. We do that sometimes to our own detriment because we're fervent about helping. I'd like to be, but I've got to keep the doors open for the many. The business needs to go on so that we can do the outreach. And so, just as a patient has a caregiving pocketbook, well, we kind of have a caregiving budget that needs to be filled as well. So I'd like to see, and that's going to occur through shining a light on patient advocacy and having healthcare debacle hit somebody that can drive change. All too often we don't see any change until something affects the lives of a legislator. Yeah. And then there's a bill introduced. And then the right thing to do is enabled. And so I'd like to see our country to do a little bit more for the people who have done so much to bring it to where it is today.
Great answers, Nancy Ruffner. If you're interested in having Nancy speak or working with her, you can find her at Nancy Ruffner. That's RUFFNER.com, NancyRuffner.com. And I'll paste some links in the show notes to her different social channels. She's quite active and gives a lot of amazing advice out there, totally free, through different videos and web series and things she does. Thanks again, Nancy, for being with us.
This has been my absolute pleasure. Thank you for the opportunity.